Here are the 4 blocks for doctors.
FCTD. Face-to-face, comfort, treatment, and diagnosis. Face-to-face. Everyone in the practice needs to practice good face-to-face. If we connect warmly on a human level to establish trust and open communication, we can give exceptional care to patients and support each other as a team. As a doctor, you lead a clinical team and must also serve as an example of how to do this successfully. To help you master your role, you will be given effective actions to focus on from time to time. To give some examples in no particular order, here are some 4-block tasks centered around face-to-face that you'll master in your role. Greeting patients, warmly asking, "How are you?" Making personal comments from notes. Having superior presentation in your physicality and mannerisms. Making positive comments about your assistant. And arranging post-op follow-up calls. Here are some sample effective actions. 1. Every time you reference a purple personal note with a patient, swipe. 2. Every time you tell a patient to expect a post-op call from the assistant or a doctor, swipe. 3. Anytime you make a positive comment about your assistant, swipe. 4. Anytime you remember to greet a patient with an appropriate touch, swipe. 5. Every time the patient laughs sincerely, swipe. Comfort. A successful practice is built on patient comfort. Providing for and protecting the comfort of each patient builds on and deepens trust, and it allows the patient to accept our diagnoses and recommended treatments as being in their best interest. To help you master your role, you'll be given effective actions to focus on from time to time. To give some examples, in no particular order, here are some 4-block tasks centered around comfort that you will master in your role. Applying expert control of instruments and having a light touch. Practicing flawless injection technique, needle selection, administration site, and so on. Combining quadrants for restorative and scaling treatments. And using mouth props and rubber dams when appropriate. Here are some sample effective actions. 1. Every time a patient comments positively on your needle technique, swipe. 2. Every time a patient accepts a mouth prop, swipe. 3. Every time a patient accepts a neck pillow, swipe. Treatment. As a dentist, you have a commitment to performing excellent, caring treatment. As a producer in the practice, you have a commitment to hitting your benchmarks and performing your duties efficiently. Keeping your clinical abilities sharp and focusing on patient comfort are how you bring value to patients, support the team, and contribute to the success of the practice. To help you master your role, you'll be given effective actions to focus on. To give some examples in no particular order, here are some 4-block tasks centered around treatment that you'll master in your role. Maintaining superior forehanded efficiency with assistance. Documenting and presenting intraoral photos, every patient, every time. Aiming for an unprompted wow from the patient to before and after photos. And meeting and exceeding your production benchmarks. Here are some sample effective actions. 1. Every time a patient reacts enthusiastically to their post-op photos, swipe. 2. Anytime a patient compliments your technique or the treatment experience, swipe. 3. Every time a patient leaves on time, swipe. 4. Every time a patient is seated on time, swipe. 5. Every time you do additional dentistry not on the original treatment plan, swipe. Diagnosis. Your ongoing mastery of clinical abilities and people skills will enable you to develop efficiencies that allow you to diagnose dentistry accurately and present it persuasively to ensure that patients understand their options for treatment while staying on track with your production benchmarks. To help you master your role, you'll be given effective actions to focus on. To give some examples in no particular order, here are some 4-block tasks centered around diagnosis that you'll master in your role. Performing all hygiene checks in less than 4 minutes. Using intraoral pictures to present treatment options. Prescribing and presenting treatment without dental jargon. Treating the patient, not the insurance, and having a commitment to facilitate, book, explain, and financially coordinate with the patient according to their needs. Tracking dollars diagnosed per exam. Here are some sample effective actions. 1. Every time you diagnose and book dentistry in a hygiene check, swipe. 2. Anytime you complete same-day treatment, swipe. 3. Anytime you explain completed treatment using intraoral photos, swipe. 4. Anytime you do a hygiene check in 3 minutes, swipe.